I'm Dr. Asavari Manvikar. I welcome you all to CAR webinar series. It's a global webinar series, and I really welcome everybody to this. So, Council for Ayurveda Research is an international non-profit organization based out of the USA. It has a sister chapter in India by the name of Ayurveda Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Our mission is to encourage, educate, and facilitate basic clinical interdisciplinary research. Vision is to promote, establish Ayurveda, and make it globally accepted. So please do consider joining us as a member, which will bring you access to all our resources. No nonprofit can operate and succeed without volunteers. So consider joining us as a volunteer. We can place you in a variety of projects based on your skills and interest. Once again, visit our website Ayurveda Research, ayurveda.com. AyurvedaResearchUSA.org. Let me introduce Dr. Purvi Vyas. She has been awarded PhD in Ayurveda from prestigious Gujarat Ayurveda University in 2010 at Jamnagar. She has also completed postgraduate diploma in yoga and naturopathy. She has gained vast clinical and educational experiences in different institutes during the past 15 years. Her major focus is on the quality of life of common and in particular oncology patients to counteract side effects of radiotherapy and chemotherapy. She gains experience for 6 years in geriatric management under government research projects. She has successfully helped patients with various diseases such as anxiety, depression, sleep disorder, various skin diseases, rheumatoid arthritis, osteoarthritis, weight management, allergy, post-traumatic disorders with the help of Panchakarma. She has also published 4 research papers in peer-reviewed journal. She participated in numerous international, national Ayurveda conferences and appeared in live TV radio shows giving Ayurveda advice. Dr. Purvi will be presenting on efficacy of Ayurvedic Rasayana therapy with cancer treatment as an adjuvant therapy. I welcome you all. Dr. Purvi,
Thank
now
you.
I hand over it to you.
Thank you. I think Hi, Miss Harita. Yeah, so today is a big journey, and I am very much fortunate and I am very much pleased and happy uh, to get invited with the CAR, that Council of Ayurveda Research. Dr. Asavari, Dr. Pratibha, they are doing this is very wonderful job. As when we can say that research-based evidence is always been lacking in the field of Ayurveda. And we have always been looking towards getting something on documentation like pen and paper to show the world Ayurveda is giving some benefit. It's always been there. We do believe it. The people who is getting treatment, who is getting some herbs and supplements, they are also feeling it. We as Ayurveda practitioner, we also found very wonderful result. But documentation to get all the people, like research people on one platform and let them speak out, this is a big thing. And I really salute and respect Council of Ayurveda Research and all the voluntary team about that. Thank you very much to giving me an opportunity about this. Now we are started our topic today, and let me start the topic. So we are coming with today is the efficacy of Ayurvedic Rasayana therapy with cancer treatment as an adjuvant therapy. When we take a look on this title or this research subject, it was a big journey for me on back years like 2002 to 2005. When I decided this topic, it was a very big question from asked from my mentors. Why you are selecting this topic? Why cancer? Why cancer's adverse effect? I said, like, throughout my journey of my graduation in Ayurveda, I always saw the people, cancer patients, they are suffering with lots of side effects. They forced sometimes to leave off their good treatment to get cured of that from the cancer. And that makes me always sad. So that's why I was always feeling, and when I was studying Ayurveda, there was a big hope in my heart, like I think if we work together as an adjuvant, like we can say about the combination of therapy or something to fight this dreaded situation, cancer, then we can get some of them like very good results. They can feel quality of life. They can feel they are getting life with the cancer treatment. And starting the story of, we can say, the research, right? When I was started educating the people to enroll in my research, that was very hard for me even. When I was going to work to the my cancer patients who are I enrolled with the oncology group and oncology hospital, and I said like, are you comfortable to join in this research because I need a consent? And they says, are you treating cancer? Are you making me free from this disease? Because think about the cancer is a big stigma, big toll on their head to get rid of that things. It's not they don't have any kind of side effect with that life is not like very happy. It's like they are getting lots of side effect with that, but the cancer, the stigma word cancer was always been there. So it was very hard journey for me, even for my patients also. This group and this project was decided with the IPGT and RA Postgraduate Research Institute in Jamnagar with my mentor, Professor Anup Thakur. He is right now the Vice Chancellor and Director of IPGT and RA, and my mentor, late Professor M.S. Baghel, who were a director at that time of the IPGTNRA. With the collaboration, I was having one mentor from the oncology group of the GJ Hospital, Medical Hospital. He was the head of oncology group on at that time, Dr. Arvind Sisodia. So let's start this journey of research. When I say cancer and when I say introduction, it looks a little bit different because cancer doesn't need any introduction. When we say cancer, it's the most treated of all disease, we all know. And when we say the cancer management, it always comes with a certain basic therapy called surgery, radiotherapy, and chemotherapy. Looking towards the more other therapy, we can see biology therapy, gene therapy, or immunotherapy. So those are the things we always consider when we are managing the cancer on traditional way. But now, if we take a look on principles of cancer management, what they includes, what are those? So first and foremost, always when the patient diagnosed with the cancer, the doctors, the hospitals, their goal is to get eradication, like get rid of that cancer and make a patient free from that cancer. Second comes with the palliation. If they feel no, we cannot go up to that point, then they do a palliation, like make them comfortable. After that, it comes with the amelioration, means make them feel better, whatever they have a situation. And when we take a look on these three aspects, and when we take a look on word Ayurveda, we always think if we can close our eyes and we can think about it, like does Ayurveda says like same? Does Ayurveda has a definition like that? The Ayurveda, when we say it's a science of life, right? When it's a science of life means Ayurveda definition of health, it says the physical, mental, and spiritual well-being. So it always comes in our mind, and looking towards even some data, like 1/3 of the cancer patients from United States taking Ayurvedic herbal medicine back then in 2005. But now, if we can figure out, and if we do some more research, we can find out more than that. But as I say, and as I started with the council, respecting the Council for Ayurveda Research, and what they are doing, this wonderful project, and like to making all the researchers to make coming on the one point and one platform, that's a less research work documented. Yes, we need still to do a more and more to document some of the good research and put on the paper table, and then get word shout out the word of this combination of therapy. Now, coming towards the aims and objects of this research topic was, first of all, yes, to study the side effects of chemotherapy and radiotherapy. This to study the side effect of chemotherapy and radiotherapy, not in the consent of traditional way, not in the consent of, like the traditional in the sense of allopathic way. No, but to study the what is happening in the doshas, what is happening in the body while person, a human, is getting chemotherapy and radiotherapy as a cancer treatment according to Ayurveda perspective. And it was a tough, very tough for me at that time to find out the pathology or pathogenesis and understand that. Second goal was to access the efficacy of Rasayana drugs. I put a word drugs, but it's like herbs as adjuvant therapy with chemotherapy and radiotherapy. So when we can see certain side effects of, first of all, the radiotherapy, this chart shows us like some acute effect and some chronic effect. For this particular study, we selected, because of we were doing only 75 days of the project study. So we were selecting only acute. From chronic, we were selecting only two symptoms. That's called as a xerostomia and tastelessness. Xerostomia is nothing but dryness of the mouth. And why they put the word xerostomia? Because sometimes you can feel the patient's tongue is like a rock. Even they cannot swallow a sip of water. Even they cannot talk. So that much hard that they got a tongue. And tastelessness, of course, with the xerostomia, of course, maybe with the mucositis. But these are the some main symptoms we select for the study was the nausea, vomiting, skin reaction, mucositis, fatigue, and xerostomia to the tastelessness. Now coming towards the chemotherapeutic acute and chronic, right? Everybody knows when, like some even on the society also, everybody knows when we take a chemotherapy, we started losing our hair. And it was very hard to get a hair back. It takes at least 2-3 months to get hair back. So we didn't take that or certain like myelosuppression or peripheral neuropathy. But from this, we also selected nausea, vomiting, tastelessness, and mucositis as our research study. Now it's very interesting. Now coming towards the pathogenesis of adverse effect, as I say, when we were talking about the pathogenesis towards the Ayurvedic point of view, that was very hard, and that was very big frustration for me, because when I just wrote all the type of Charak Samhita, Shushu Samhita, Sarangdar, and all our old text, I never found the word radiotherapy, chemotherapy back then on that era. Then one day when I was studying my Charak Samhita and I was about to finish, at the last quote of the Charak Samhita, I found one quote that says, Yadihasti yadihasti tadanyatra yadihasti na tatkachit. Means, if whatever is in this Samhita, whatever is in Charak Samhita, you can find anywhere in the world. But whatever is not mentioned here, it's very hard to find. We can say it's nothing, not like we can say next to impossible to get anywhere in the world or any yuga or any time period of the world. So that gives me a courage, that makes me get a like good strength to find out what happened and how we can explain about this pathogenesis according to radiotherapy and adverse effect manifestation according to Ayurveda. Then repeatedly, when I was studying Charak Samhita, I found Chikitsa chapter 14, that is Arsha Chikitsa. In that, and Charakacharya mentioned that Atapa Sevana. Atapa means sun rays. So when the person is getting too much sun rays sevan. Sevan means getting the penetration or like, exposure of the sunlight. They started getting increasing about the ruksha, ushna, and tiksha gunas of radiation. It means they may cut vatavritti and pitta prakop at the same time on that things. After looking towards the all other Sanhitas called Shushut Sanhita, I found one chapter called Agni Chikitsa. Because when we were taking a look on the radiotherapy, history of radiotherapy, right? So because at the first era of the Hippocrates, radiotherapy were given as a burn therapy. So literally at the ancient time, in the time of the Hippocrates modern medicine era, they were burning that tumor to get rid of that cancer. And then eventually the research and everything start getting like lots of development in the radiation and radiotherapy started. So if you take a look on the Agni Chikitsa in the our era, like Ayurvedic era, we can see the Atidakta, the manifestation or pathogenesis of the Atidakta, that's called Agninam Kopitam Raktam Pittam Asya Udirayet. Means when we are getting too much hot radiation in our body, it may mess with our blood, like gives lots of blood impurities and may increase to a prapitta prakop in that time. And that's called as achaya prakop. That's acute. When we talk about the 6 stages of the disease, it doesn't need to be go there. It just go on the acute symptoms like mucositis, like fatigue, like tiredness, like that. So in short, that the radiotherapy does in our body pitta prakop, vata vritti, and kafakshay. That leads to a dhatupak, and we can say all the adverse effect in nutshell comes under that. When we come towards the probable adverse effect of the chemotherapy, again, that's also hard, but not that much that what hard for me as a explain about the radiotherapy. We can see Shushutacharya or mention about some particular visha, poisonous herbs, right? If you take a look chemotherapeutic drug, they are also from the plant that is about mentioned in our Sanhita as a poisonous herbs. So when we talk about this Thavara visha, means some poisonous herb, like poisonous plant, their gunas, their qualities are vyavai vikasi, means they may also cause a vata prakopa, pitta prakopa, and rakta prakopa, like manifest about some of the side effects or adverse effect we can see. So this was the I found at the context of the Ayurvedic point of view. It helps me to decide what to do and how to address as like they counteract their side effects or adverse effect. So now if you can take a look on the management of those side effects according to traditional medicine, it always says to improve nutritional status of cancer patients with the various protein powder, multivitamins and minerals, correct the adverse effect like a nausea, vomiting with antiemetics and IV fluids, mucositis with various antiseptic and pain reliever mouthwash. So we can see the like modern medicine is always been there to help the patients to get finished that those type of very hard or very tough treatment of the cancer. But when we take a look on the Ayurveda, what Ayurveda says about ideal treatment, the therapy which while curing one disease provoke another is not the correct one. The correct therapy is one which, while curing another disease, does not provoke the manifestation of another disease. It doesn't mean the cancer therapy like radiotherapy, chemotherapy, or surgery is wrong. No. But now it's a time to come on one platform, adjuvant the therapy, work together and find out some solution to improve, like maintain the quality of life by the side, to do a treatment like best treatment, offer best treatment to the cancer patients. So this was the goal of this research. And when going towards the more deep, it was always been in my mind about the word bala. Bala means our immunity. Bala means our homeostasis. Because every body, even we got like a small cut, every body start trying to get healed by our own self. That's clearly mentioned in the Charak Samhita, even that's clearly mentioned in our Hippocrates era also. So What now our goal or what now our duty to do is to enhance that self-defense mechanism, giving to the Rasayana therapy, giving some herbs like antioxidant, adaptogen or nootropic to increase or improve our bodily capacity to fight with those things. So now towards the herbs or selected herbs, what we plan to do for that present study was mainly amalaki, that called as Amla embolica officinalis. Second was the ashwagandha, called as the Vidania somnifera, guruji stem, that was a Tinospora cordifolia, Yashti matu, Glycyrrhiza glabra, Jivanti, Leptadenia reticulata. Jivanti is a very unique herb, and that was particularly found on that local, like we can say local traditional area of the Jamnagar in the Gujarat. So, and that was known in the Ayurveda as the best vegetable to eat an everyday routine. So that's why we selected this Jivanti out of the way. It is Tulsi here, Osimum sanctum, Pipali like Piper longum, because we all know, right? Nowadays, even you can see lots of supplements. It comes with the Piper longum like black pepper, and this is the same family pipali. And why is that? Because when we add pipali or black pepper, it will enhance the bioavailability of any kind of formulation. So that was the best things we selected at that time: ghee and sugar. When sugar comes to our mind with the cancer, our eyes cut open like anything. No, I don't need sugar. Like, I don't need sugar when I have cancer. Yes, we don't need sugar when we have cancer. But there was a two or three parameters we have to consider at that point. First of all, when we are selecting here sugar, that was not a sugar which we found as a regular. That was called as a rock sugar, like sharkara, that was found in particular area in the Maharashtra, and that has a wonderful quality to balance the pitta right away. Second consideration was making avleha kalpana, like something like a jam, like electuary, so people can swallow easily, because most of the cancer patients we found on that area was having head and neck cancer. So they were having surgery, they were having lots of swallowing problem, and we want to make that easy for them to take that supplement. So that was another thing we figure out, like, this will go. And one interesting subject, when we are using particular quality of sugar to balance the pitta, how it works with the cancer patients. So that's how we make a formulation in the jam, like called as like a Chyawanprash type of Avleha Kalpana. Now coming towards the clinical study, what we found on that. This was pretty, we can say we can do much more about that, but this was like as a part of my study, as a part of my master program. And that was, I was having like very limited time period, about the 75 days to 2.5 months. So but though we got lots of encouraging results, so that's what I wanted. I am very happy, and why I am very like excited to like describe about you right now. First of all, materials and methods. So where materials means where we got a patients from. The patients has been selected from the OPD and IPD from the oncology department. As I mentioned, it was a GG hospital in the Jamnagar, like same area where I did my research. And that was referred to our OPD as a IPGT and RA, Gujarat Ayurveda University, Jamnagar. That was very funny. Our both the institute were like next to each other, and lots of my patients doesn't have any kind of vehicle, or doesn't have any kind of like ability to just walk and come to my hospital. So I was always been there to like ask my patient to just sit back on my scooter or my vehicle and give them a ride and come to the my hospital and register them and just going here and there. So it was like too much like thing, but it was very good relationship with my patients at that time, and they were feeling so much comfortable with that. And next thing was a plan of study. All the patients registered for the study has been subjected for detailed examination on the basis of special prepared pro forma to select and exclude some of the patients. Laboratory investigation, we just did a routine. It was not a lengthier investigation we found at that time, or we selected at that time, because our criteria to work on the symptomatic criteria more. And I'll just explain a little bit later on also in this clinical study. Our criteria was more towards the expand and explain more about the Ayurvedic research methodology on this study. Now coming towards the inclusion criteria, I selected diagnosed cases of the carcinoma stage T1, T2 being submitted for the radiotherapy and chemotherapy both, acute short-term adverse effect, and under the age of 70. As I mentioned, we did selected acute short-term, but from the chronic, we selected only two symptoms, that was xerostomia and tastelessness. Now coming towards the group, there was a little bit bigger study. It was a 4 group, but I select now 2 groups only, looking towards our time limit and about the I wanted to give a full time to explain each and everything. So group A we selected here is a radiotherapy and chemotherapy as a control group. So we were just observing them. B was a radiotherapy, chemotherapy, and Rasayana AVLEHA means a Rasayana therapy group. Duration was 2.5 months, and dosage was 30 gram a day with ghee, 10 ml of the ghee. That was pure cow, we can say like cultured ghee, and that was we were preparing in our pharmacy. Assessment criteria was done on the basis of improvement in the adverse effect mentioned by National Cancer Institute Oncology Group Guideline. Also, assessment was done, like as I explained, we were trying to take out the research methodology from the Ayurveda as a parallel parameter in our research. So we found in Charaka Vimanasthana, it was giving a research methodology to figure out how the person or how the patients are getting benefited. There are 4 main criteria given by the Charakacharya. Was a Rogabala. Rogabala means the bala means strength of disease, Deha bala, strength of body, physical body, Agni bala, strength of our digestive fire, and Chetasa bala means our mental and spiritual strength. So that was the 4 other criteria also we selected to evaluate the improvement in those adverse effects. Now coming towards the total number of patients, we can see this was a 36 patients, but few of them has to leave the treatment in between because of certain reasons. They cannot finish it out. Now this is about the scenario. We can say this is a like their geographical data where the cancer we can have found like more head and neck cancer than breast cancer, because of course the female was also registered and there were some breast cancer scenario was always there. So there were a most important towards that we have to work on their smoking and their tobacco chewing habits on that. If we can work on that and they don't get that this much percentage of the head and neck cancer on that area. Now towards the taking a look on the Ashtavida Pariksha. Ashtavida Pariksha means a personal history, but Ayurveda explain very wonderfully about how to explain that and how to figure out what the area on the society or how to approach your society to address certain things and not getting that this type of bad disease like a cancer. So we can see alcohol or pan masala like a vyasan, like a smoking and tobacco chewing was there. We can see about the mainly about the prakriti. I evaluated all their manasa and sharira prakriti. Also, we found more about the vata kapha persons on the 50% of the patients. Now towards coming to the chief complaint. Again, this is very interesting because it was when we were addressing or we were registering the patients, right? They were getting radiotherapy and chemotherapy. They are just starting. And we are also starting at that time some about our Rasayana therapy. So at the time of the day 1, as if we know some of us are a research person, then we can understand on the day 0, what we consider as a before treatment parameter, that was a 0 for both. That was a 0 for the even control group. That was a 0 for even medicine group also, because there was that's just treatment was started. So it was very confusing for me how to do calculation, how to do a statistical value. And then I did research with my help of my mentors, and I met some few of statistical professors, and we figure out the day 30 when they are already taking since 30 days about the Rasayana therapy and about the radiotherapy chemotherapy, we consider as a before treatment parameter like day 0, and then we evaluate them up to the 75 days. So that's how it was designed, and we can see some of the symptoms. This was not at the day 1 of starting of the chemotherapy radiotherapy, but we can see here this is about the day 30 of the radiotherapy and chemotherapy. So most common thing is a fatigue, tiredness all over the body, nausea and vomiting, mucositis. We can see on those symptoms are already making their life so miserable. We can go more towards the down in that even each and every kind symptomatically relief. So like this graph, these bars are showing us how we are reaching out on every 15 days of the parameters without Rasayana therapy on in the contrast of the control therapy. So this yellow line, like yellow bar, showed us the therapy, the symptoms at the 30 days, it was like 25%. And after that, nausea and vomiting deteriorating up to the 75 days, and this was a very less about the 10% of that. But here is very interesting thing. We started Rasayana therapy with the radiotherapy chemotherapy from before the day 30, like at the day of the 0, but we don't get that much result up to the time period of the 45 days. But after that, we got a big spike of the result, getting more highly significant results up to the 55 days, 60 days, and going further towards the 75 days. So this graph shows how Rasayana therapy is helping to increase the tissue defense mechanism, to increase their own ability to get rid of certain symptoms, certain adverse effect, and getting out of those all the bad adverse effect. Next is a mucositis. Mucositis is nothing but we are getting lots of bad sores on the mouth, and it's not like only stomatitis. This is a mucositis. So it is a more bad, or we can say more inflammatory than only stomatitis. Some patients I saw at that time, they were feeling like they are getting bleeding on the mouth, and it was very painful, very burning, and it was like miserable for some time. We can see here on the result wise, on the yellow bar is again it's a control group here. We can see after the 30 days this mucositis was deteriorating up to the 23 to 30%, and it is deteriorating more further about the 40 minus 40% or 45%. And gradually when the time is ending and about it was trying, our body was trying to handle it, or our body was trying to clean it or relieve it by its own self in the 60 or 75 days. But just take a look here on the Rasayana therapy group. When we can say it was not deteriorating at all, but it was improving at the day 30, about the 20%, or about, we can say about the 18%, and it was gradually going better, better, and better. So people, when we talk about the mucositis, it's not about the pain, it's not about the burning sensation, but the mucositis about people are not, or patients are not able to eat food. People are not able, patients are not able to drink anything. Patients are not able to get proper nourishment because they have ulcer, they have inflammation, they have a pain, they have a burning situation in their mouth. So that's how, when we are taking a look at these things as a Rasayana therapy, as I mentioned, Rasayana is nothing but to nourish our tissue. Rasayana, Rasa means our tissue, our lymph. Ayana means make them flow fluently. So nourish those tissues, improve the quality of tissues, improve the self-defense mechanism. That itself is healing the body. That itself is helping the body to counteract this adverse effect on these things. Now we can see the fatigue. Yes, fatigue is very miserable. I saw some of my patients has to quit their job while they are taking treatment. they has to depend on somebody while they are taking treatment, because they were not able to do it. When we say the fatigue, there are different categories of fatigue, but when we say the fatigue caused from the cancer treatment, that was a very miserable. Patient can feel like, they can do focus, they can do certain things by their own self. So it was a big impact on their quality of life when we are feeling fatigue with the cancer treatment. We can see here on the control group, it was like at the day of the 30, it was like, going down as a -5%. Then gradually body was trying to heal itself, body was fighting with itself, because we can see on the further, like, previous slide, there was a more pitta kapha and more vata kapha patients. So when we can say the kapha patients, they have their own good immunity. When we say pitta kapha patient, they have also their own good immunity. So they were trying to get their best to deal with their fatigue, and that was improving by the time without doing anything while taking radiotherapy and chemotherapy. But again, that was going more down, and then again. So we can see on this yellow chart, like zig and zag, like, the patients are feeling fatigue up and down, and it was like, making their life very bad, because it impacts on very bad quality of life. But here we can see on this green bar, see, it's very straight, like we can say it's like, star falling from the sky, it says like that. And we can see the gradual improvement is always there. Why is that? We are not doing anything for fatigue, but we are making the body self mechanism or self defense mechanism improve. That's all we did. And that was helping them fatigue, because they were like, see, we can saw before also, like mucositis was better, mucositis was not that bad, the nausea vomiting was not that bad. So they were able to eat, they were able to have this supplement on time, and that was helping to deal with their fatigue and their like, their bodily energy. Now, if we take a look on the xerostomia, as I mentioned about, xerostomia is not considered as acute, but we did selected it because we want to see some of the chronic symptoms where we can address, or how we can address them. Because if you take a, or if you have any time in your life to take a chance on real xerostomic patients, it is very painful. You feel really sad looking towards that tongue, which cannot lift up by itself, which cannot swallow one drop of the water, which cannot speak out because they cannot lift up their tongue. It's very bad. So that's why I discussed with my guide, and I convinced them to, I wanted to select this one, and I wanted to work on this one. I know I'm not getting that much result. You can see here the result was insignificant. Result was not statistically significant, but I wanted to see whether we can put like at least half of the drop, or some input in that type of bad symptoms also, or bad side effects also. So we can see here, when we were talking about the xerostomia in the patients in the control group, it was at the day of the 30 started less than, like, worst at the 30%. It was going more than 65%. Then it was about to steady. Because I found after my study was only 2.5 months, but I was in contact with my patients up to next 5 years or 3 years, at least, whatever their lifespan, because I wanted to see their lifespan also. I wanted to see their secondaries also. So I wanted to take a look on their history and how they are dealing with that. And that's why. But like this xerostomia takes a very long time to recover. It takes more than 6 months. Sometimes it takes more than 8 months to recover by itself. And when we can see here the xerostomia in our Rasayana therapy group, see, in the day 30, where we were on the control group -30, here we can at least reaching up to 10%. And that was a big achievement for me at that time. And when we were seeing this graph up to just going up and up to the 75 days, we can see we can recover this bad side effect or bad adverse effect with less time. So we can save their, like, improve and their quality of life accordingly. Same way with the tastelessness. Xerostomia comes with the tastelessness. Because when your tongue is dry, your all the lacrimal glands, your salivary glands, all are dries up, all are burned out. You cannot able to secrete anything, so you can taste anything. So we can see here at the day of 30, it was a good, it was not that bad. But just take a look on the day 45. Here we are not getting a result in our Rasayana therapy group. It was the zero, it was not there, but it was not improving at all also. But when just take a look on this yellow bar, it was going down up to 90%. There was no taste. Think about it. If I have something very tasty food and I'm a pitta kapha person and I can't taste anything, it just give big trauma to my mind. It will give you big trauma to my heart also when I cannot taste anything. And it's not like only physical problem, it is big psychological trauma also. Then we can see about up to the 45 days, 60 days and 75 days, it was all below the zero. So it was hard, it was very hard for the patient to taste anything up to the 75 days where I observed them. But even we are taking here in the Rasayana group, at least we found, though it's insignificant result, but at least we found up to the 20% of the betterment in their symptoms. So that was a big achievement for my point of view. It might need a longer work, a lots of research to document and to prove it. But yes, it was some of the symptoms relief, some of the improvement was also there, and these symptoms also. Now coming towards the Ayurvedic parameters. When I say Ayurvedic parameters, and we are explaining about the Charakacharya who explain, when we talk and when we do research, we have to keep in our mind four basic parameters. First is a Rogabala. Rogabala means your strength of your disease, strength of your adverse effect. Then it comes with the Deha Bala. Deha Bala means your bodily strength, your physical bodily strength. It will consider with your Balavruti. Balavruti means weight gain or weight loss. Swaravarna Yoga. Swaravarna Yoga means it will call about your skin color. You can see the cancer patients when they are taking chemotherapy and radiotherapy, their skin looks dark, their skin looks out of the glow, their voice was becoming like very dull, like we can say harsh, because lots of vata imbalance, lots of vata vritti were there. So that's considered in the Deha Bala. After that, we can consider about the Agni Bala, as I consider Agni Bala as our strength of the Agni. Because when we are talking to work with the Rasayana therapy, when we are making our tissue stronger to fight out with this, improving their self-own defense mechanism, we need to improve the Agni. We need to improve the digestion. Without that, we cannot do anything. So that was also considered in the next slide. And last was about the Chetasa Bala. Chetasa means the strength of the mind. And Ayurveda in the Charak Samhita, it considered the four basic parameter. Nindra. Nindra means how do you sleep? How's your sleep? Sukhena cha pratibodhanam. I always ask my patient, always, or even my client here, always, though they are not cancer patient, I always ask them, how do you feel when you wakes up? Are you feeling fresh? Are you not feeling fresh? If you are not feeling fresh, how much you are not feeling fresh? Vaikharikanam swapna darshanam means how are your dreams? What you can see on your dreams? They are scary, they are happy, they are in the dark. How are those? Then mano buddhi indriya avyapati means how is your sense organs? How is your vision? How is your manas? Like, are you feeling foggy? Are you out of the focus? Those are the very small things in the cancer treatment, but that impacts big on your quality of life always. So looking towards, like I'm going previous slide first, Deha Bala. So looking towards the physical fitness, we can see the control group got a relief of the 4 and 6% on the both. And we can compare with the Rasayana therapy, we can find like 45 to 55% of the improvement on this aspect of the study. We can say on more further about the Agni Bala, right? Agni Bala, first symptom is a Jeerna Ahara Shakti. Jeerna Ahara Shakti means when I am finishing my food, do I feel or does I feel it's my digestion is starting right away? So we can see the relief is a 12% here on the control group, but in the RA group, like Rasayana therapy group, it was a 52%. Abhyavaran Shakti, because of mucositis, because of tastelessness, because of xerostomia, lots of patients were not able to eat enough. So Abhyavaran Shakti is nothing but how much you can eat. Are you feeling full with one or two bite, or are you finishing up to what you want to eat? So we can see here the relief was 8% only on the control, and we can see in here Rasayana group it was a 50%. Ruchi. Ruchi means you feel good when you feel to eat. How's your ruchi? Like you feel interest in your food? So that's called as a ruchi, and that's very important. Though it doesn't consider like most of the time, but ruchi is most important. When I saw the food and if I feel no, it's very tasty food, then my secretion, my brain started giving me a signal to digest it and start releasing all the enzymes. Then that's how I can digest everything. So that was a 10% here, and we can say it was a 50% here. Vata Purisha Mukti, that was a very hard for my patients at that time to get their bowel movement regular. It was very tough because of lots of Vata Vritti. We can say it's it was a miserable. It impacts very badly on their life, like their quality of life. And we can see the Vata Purisha Mukti was 80% improve in this RA group. Why? Because our formulation was based on the AVLEHA. When we made AVLEHA, we add lots of ghee. We took some herbs called pipali that also it's like Agni Vardhak, improving the digestion. Even we add a 10 ml ghee in that avlehium. When they are taking it, that jam, adding the one two teaspoon of the ghee, mix it with that before taking it. So that was also helping on their vata prakop or vata vritti, vata vitiation at that time, and improving in their bowel movement. When we can see about the Chetasabala, then Chetasabala is like about the Nindra. We can see here Nindra means sleep. There was a 75% improvement in their sleep when they are taking on the Rasayana therapy. And here also we can say on how they were feeling when they wakes up. See, in the control group, it was 3% only, but we, in compared to that, we can see here the 50%. So likewise about their dreams and about their foggy feeling, they got improved a lot in with that Rasayana therapy. Now coming towards the we might have a question: how this Rasayana herbs or how this Rasayana Avlehiya was helping. So these are the some of the research based data or research based analysis what we found, like how they might be helping on that according to modern aspect, because we have to establish our modern parameters or modern aspect also when we are using certain Ayurvedic medicine or Ayurvedic herbs, right? So major selected drugs for Rasayana Avleha, like Tinospora cordifolia called Kuduchi, Videnia somnifera like Ashwagandha, Ambelica officinalis like Amla, Piper longum like Pipali, Ocimum sanctum like Holy Basil, having adaptogenic effect activity. And when we talk about the term adaptogen, it's used to discuss a group of a plant that have the ability to increase the resistance of the body to a wide range of physical and psychological factors which are known as stressors. Again, we use some of the herbs which has a highly antioxidant. Here we have to consider one more point also. That was a very interesting story, but I'm making very short. When I was doing a research, right, my guide was the head of the oncology group department, and we were doing very flawless work. And in between, the something happened, and our head of department got changed in the oncology hospital. And he came up with some of the parameters. He says antioxidant should not use when we are giving radiotherapy because it may interfere with the radiotherapy. And he forcefully stopped my all the research, and I was stuck over there. And it was very hard for me to work more. And then I just tried to meet him again and again. He was not giving me an appointment. And finally one day he asked me to come to the get an explanation. And he says, you know what, I am giving a 1 week research team, and you have to explain how you can give and why it's not interfering in radiotherapy. If you proved it, then I'll go further and I'll give you permission to work ahead. And I was doing research and research and research, and I was getting one very wonderful article from the JAMA, I think, a Journal of American Medical Association itself was saying, when we are taking any antioxidant through our digestive tract, it won't release that antioxidant effect on any cancer cells. It won't release the antioxidant on the damaged cell. It will give antioxidant results only the cells their DNA is healthy. And I proved it at the time, and that was like a big achievement for me. And they were also relaxed, now it's not interfering with the radiotherapy. So it was got clear at that time. So we use lots of antioxidant like amla, and like piperlongum has also antioxidant activity, and that helps a lot to people get rid of the fatigue. Beta carotene have a nootropic activity which present in the Glycyrrhiza glabra, like yashtimadu, work as an immunological depression to inhibit the excess secretion of the catecholamine and cortisone. Now coming towards the anabolic activity, which presents in Amblyca officinalis like amla, increase a positive nitrogen balance and total protein level leads to an increase of body weight. This increase the body weight was not like bad body weight, but that's the real body weight where the patient were losing with the treatment, or patient were losing because of cancer. So amla was helping on them to balance their body weight at that time. When we come to the essential fatty acid, which are present in a grita, like ghee, clarifying medicament, micellin form and penetrate in any normal cell, after that beta oxidation occurs and medicament released to the target tissue. So that's why we use the vehicle as a vehicle, the ghee most, because Ayurveda has always big importance how we are taking herbs, how we are taking with what thing we are taking with honey or ghee or sugar, or how we are taking it. So that has a big impact on all the, what we say, like a release on the target tissue. The major role of it established as a precursor of a prostaglandin. Now coming towards the conclusion to all this study, we can say many more to do, but still if we can have to conclude a little bit about that, then we can say maximum highly significant results were found in nausea, vomiting, mucositis, fatigue, and weight gain. In symptoms like a xerostomia and tastelessness, results were insignificant that suggest the need of long-term Rasayana therapy. This therapy certainly improves the quality of life of patients and enhance the life expectancy. Thus, it can be concluded in a nutshell that Rasayana AVLEHA is an effective adjuvant therapy in protecting the patients from the adverse effect of radiotherapy and chemotherapy. So I'm concluding my session here, and I'm going hand over to Dr. Asawit. Thank you very much to listening, everyone. Thank you.
Thank you so much, Dr. Purvi. It was a wonderful, very, very insightful lecture.
Thank you.
So does anybody have any question? Anything you would like to ask?
Yes, Ms. Harita.
Oh, I don't have a question, Dr. Purvi. I wanted to say it was a very nice presentation. A lot of useful information that I found in your presentation.
Thank you. Thank you. I really appreciate that.
Yeah, and there are many different things actually I really appreciate about your work. Definitely there were a lot of obstacles, and through that actually you came and you made it actually. It was
Thank you.
to hear about that.
Yeah.
And I'm glad actually you talked about sugar being a part of AVLEHA, which is actually very important, content, and you cannot get rid of it. And most of the times when I see also the clients who have cancer, it is so much challenging for them to understand this aspect, because when you look at, the sugar that we get is highly processed versus the sugar, which is the rock candy, is very different. Its quality is very different.
Yeah, you're right. After my study of next 10 years about the I think 2015, my guide was always calling me when he found some of the cancer and it was a very bad side effect. He was always calling me, can you make this your Rasayana AVLEHA for my patient and send it to me? And I was always very happy to help all those patients to get rid and just finally that finish their cancer therapy at that time. And as you absolutely say, it was very hard to even make the oncologist understand that we can administer some certain amount of the sugar in that with that cancer therapy.
Right. Absolutely. And I also like the integrative approach. So it was not only using the modern parameters, but making sure all the important parameters from Ayurveda and looking into the textbook, using all the classical references. That was absolutely amazing.
Thank you.
Yeah.
Like as I mentioned, one of my mentor, right? Sadly, he just passed away 1 month before. Late Professor M.S. Bakel. He was always used to say me, Purvi, when you are treating one disease, right? So disease just consider as a battle.
Mhm.
So when we are in battle, we need a sword and we need a shield. And particularly when you are fighting the battle of the cancer, you need a shield and you need a sword also. Sword as allopathy medicine to cut down the cancer, but you need a shield to protect the body as a help of the Ayurveda. So if we work in that integrated way, then I think we can get a very fine and very wonderful solution of the cancer treatment and find something good.
Absolutely. And I just have, like one, not a question, but I'm just wondering about AMA symptoms. If you look at any AMA symptoms in these patients, and whether those things, those kind of symptoms were relieved, or did you find anything about it?
Yeah, so when we talk about the ama, that's inflammatory situation, right?
Mhm.
And when I explain the manifestation, like pathogenesis according to Ayurveda, and what I saw on the patients also, that was acute. That was achaya prakopa.
Mhm.
It was not going on the sanchay prakopa prasaravastha. That was not going on the sanchay, like accumulation of the dosha. That was very quick. Even the day one, when certain patients, particularly on the lung cancer patients, they are taking some chemotherapy and they started sudden of some symptoms.
Mhm.
So there might be, if we can take a look of the mucositis, the pathology of the mucositis or pathogenesis of the mucositis according to modern aspect. Yes, it is a itis, right? So it is inflammation. But when we are treating, if we treat as a the just digest the ama and then go more forward on heat, that would be not like that much helpful at that time because people are or patients are lots of in the pain and discomfort.
Mhm.
So what our goal was to administer the Rasayana therapy to boost their immunity. And yes, as we talk about the inflammation or ama, if we administer turmeric, then it might help, right?
Mhm.
So you might be thinking about the turmeric when we are talking about this AVLEHA and everything. But when I was planning to make this formulation with these herbs, like selecting the herbs, my sir, like my mentor, asked me to give me a 15 days break
Mhm.
and asked me to just go to the all over the India where the doctors and vaidyas are doing Ayurveda therapy for the cancer patients,
Mhm.
and then visit them, meet them, and just take their opinion. What you need to do, what are the herbs we can select, how we can add, what the formulation is the best, how we can do it, because there was like a very first pioneer study in our university at that time.
Mhm.
So I visited few of the area, like in our Gujarat, some clinics, like if you know about the Ahmedabad, there is a one Anandmai ashram. They are doing all the cancer patient treatment. So I met their doctors. I go there, the Lucknow, the cancer CDRI Cancer Institute, Drug Research Institute. I went the Jammu also. I went in Jaipur also, and meeting the people and Vaidyas, like what are the herbs I have, because the very straightforward the suggestions from the oncology department or oncology hospital was you cannot make two formulation. It has to be simple, it has to be one, and it has to be very easy to palate, because patient will have like lots of dryness. So after that, taking all those aspects, and I still remember one of the doctors, Vaidya, she asked me, like, when you are talking about the adverse effect, only talk about the adverse effect. Don't take, don't distract to treat a cancer.
Right.
And don't even think about it, because if you are looking towards the pitta prakop, if you are looking towards the dhatu pakavastha, if you are looking towards the vata vritti, and if you work on the inflammation, that may aggravate the pitta. So it might got contradictory. So I think if we can make a work like comparison of the taking something anti-inflammatory with Rasayana, or anti-inflammatory without Rasayana, and one group only Rasayana, and compare with the control group, I think we can get a more fruitful result and encouraging result with that also.
Right. Absolutely.
Yeah. Yeah.
Very true. Yeah. And I was also thinking about, like, when we look at the indications like Arha and Anarha. So if somebody is having a lot of ama already, is it a good indication to give AVLEHA or not? So that's what my focus was. But definitely, I mean, there is so much that we can do. There is a lot of studies definitely we can do, and integration is the key, no doubt about it.
Yeah, best thing is to admit all of them patients and give a proper food, same food for all the patients, make their diet nice, according to pathyas, according to what Ayurveda says to eat, take care about their amavastha, take care about their rasayana thing also. And if we do like that type of work, and then I think we can get more encouraging results.
Absolutely. That's amazing.
That's my dream also.
Yes, absolutely. Great, thank you.
Thank you.
Yeah. So thank you everyone for attending our webinar. So, and please watch and subscribe to our video channel. So this webinar will be uploaded to CAR video channel. So please like, comment, and share the videos. Once again, I invite you to all to become member of CAR. There are a lot of different activities that we do at the CAR, Council for Ayurveda Research. And you can now also subscribe to IU Update. So that is a newsletter that we have started again. So just stay tuned with all our projects and events. And if you have any questions, please email us at Ayurveda Research USA at gmail.com. Or you can also email me, asavari at mnayurveda.com. Right? Thank you so much.
Thank you, Dr. Asavari. Thank you for giving me opportunity. Thank you, Ms. Harita, Jasmine, everyone.
Oh, thank you, Dr. Purvi.
Thank you.